So the moment after that, he got operated.
How's he now?
He's amazing. So at the time I was doing my fellowship, every time he's come for a follow-up, he's always got sweets and all for you. And he's been like, you're the reason why I got operated and why I'm alive.
Coming to our final section is the rapid fire section. So are you ready for it?
Not at all. Especially with you on the opposite side, I'm not at all ready.
No, I've kept it very simple. We're going to call you again where we're going to have even more brutal questions, but
Okay.
we'll start.
So the brutal questions need to go both the sides. They cannot go one side.
Okay. One thing you would like to change about dentistry in India?
The only thing that I would like to change is like people need more exclusive hands-on. Agreed. Now my personal perspective would be like you need to learn how do you work in a clinic. Clinic work is totally different. The one work what you're doing in the department is totally different. Like you need to be, I feel, you need to have a posting in which you are handling the patient in all the aspects.
You're out of college and you are ready to work in a clinic, which is not the case.
I was, and I still am a gunner.
Okay.
Arsenal.
I mean, it's been a rough last few years, a last decade for you guys. But
But I can still remind you about the Invincibles. 49 unbeaten.
we were the ones who broke the record, unbeaten record, by the way.
Still, you couldn't manage to break our record.
That's a different podcast.
You might get many trophies, but you do not have a golden trophy.
We'll have a Arsenal versus Manchester United exclusive
Friendly exclusive.
episode once. Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions podcast. Our guest for today is Dr. Sohin Chaudhari. He's completed his masters in Oral and Maxillofacial Surgery from DY Patil, Navi Mumbai. Dr. Sohin is also an Oral Oncologist who has worked with Fifa, AFC and the IPL as an on-field dentist. The audio podcast is available on Spotify and Anchor. The links to that in the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode. So Dr. Sohin, you have done your masters in oral surgery. So why oral surgery?
So for me, since the beginning, it was always about becoming a surgeon.
Okay.
So not necessarily, you have to become a doctor. Like there are thousands of people who become a doctor.
Mm-hmm.
But eventually, few of them become a surgeon.
Okay.
And you get the
Makes
privilege
sense,
to have a scalpel in your hand, open up a patient. That whole thrill is completely different. So I had that thrill that, no, I want to become a surgeon, not a doctor since the beginning. So as we got into dentistry, then I slowly learned, okay, there's a surgical branch. So I had already heard about it, but I did not decide which side exactly to go to during my dentistry. So later on when I found, okay, this is the surgical branch, this is the huge scope of work that we do, I was really fascinated with everything that they do. And I was like, if I'm doing my masters, it is only oral surgery or else I'm not doing.
So that was your, your point that you have to do in oral surgery itself.
So it's either oral surgery or else it's nothing.
But was it like your first preference?
No, it wasn't my first preference.
It was the
only preference that I would go for.
Okay. But what were the moments where, probably during your UG days that you decided ki you saw something, like you saw a procedure and like, ye mujhe karna hai, ya, I think I will do oral surgery only. One was the mental thing ki if I want to do, it has to be surgery. But then aisa koi tha during your UG days where you thought ki, I think I have to do this. So it's like a moment tha.
Yeah, so once what had happened was you're posted in the department for around 15 days. So I had seen a patient come in and we knew the PG. So we went and spoke to the PGs. Kya hai? What is this case? What is it about?
Barabar.
They're like, so you're going to do a jaw surgery and everything. I was like, okay, so there'll be a huge scar for the patient and everything on the outside because you don't tend to think how is it going to work as a UG or as a layman. You don't know exactly.
Barabar.
So then they were like, okay, this guy's getting operated tomorrow. He'll be coming for a follow-up. He'll be getting discharged, coming to the hospital again in maybe another 2-3 days. So that time you have a look at him. So the time I saw the patient, he was looking completely different. Like the patient did not have a jawline, the patient had a jawline, the patient I'd seen had a gummy smile, the gummy smile was vanished. And I'm looking, where are the scars actually coming from? And I was like, how did you manage to do all this? So that is the time they told, this is the beauty of oral surgery. You do it all from the inside, nothing from the outside, unless and until it is required.
Wow, I did not know that. Like that's a very good line. Like do it everything from the inside and not from the outside.
Yeah.
So how was the whole MDS journey? You did from DY, so how was it?
Yeah, so MDS journey was really wonderful. Like since I was an undergraduate student at DY itself, so we knew the staff, we knew the teachers, we knew how to go and approach them if we had any difficulty. Yeah, but at the same time, they're pretty strict about work. It was like a huge family that was there, like all 18 postgraduate students, all 10 teachers. It was like a huge family of around 28 people who are all closely connected. And in that, there are instances where your seniors are just bombarding you with work, this, that. You feel like, dude, why did I choose this life right now? You fall sick, then you're like, I miss one call, the seniors again gonna come at you. How did you miss a call? So rather than the work, they would again keep on firing you. So, but overall, the journey was really nice. As a first year, you wonder, what are you doing? But the first year is actually the most important year.
The core part, yeah.
Yeah, because you are not well oriented with how the hospital works as a dentist when you go. Like not the mainly of the course, surgical part.
That's an added benefit that you also get to work in a proper hospital.
Yeah.
Full time also. Yes.
Correct. So as a dentist, when you just enter, you're like, okay, I'm an oral surgery, oral and maxillofacial surgeon. I'm a postgraduate student number 1. I know this, I know that. And then you go to the hospital, you're like, oh shit, I don't know anything what's going on.
Yeah.
So the whole first year just goes into understanding the functioning, understanding what basic needs you need to have in a surgery. And mainly it's like you learn planning completely. So suppose there's a surgery that is there. So we go there, we tend to see the patient, we examine him, we get the diagnosis, and we discuss it with our seniors, we discuss it with the staff, we come up with the treatment plan. And then comes the main part during when you're operating the patient now. So what happens that time is we set all the instruments beforehand. So the instruments are set in a very specific way. Right from the time you examine the patient inside, you give an incision, you raise the flap, you see the fractures or whatever. And it's just not that. You even think about what complications can happen.
Yeah.
So you have already anticipated the complications in which area they're going to happen and you are well prepared for it. So you go into a surgery knowing everything what is around and what could possibly go wrong. What is the management for that? And just not inside. Outside also okay, now I have sutured this part over here.
Yeah.
Okay, so this is a weak part. So I need to keep an eye on this. So that way you tend to remember things and all. So these are slowly learning curves which you imbibe when you don't know anything what's going on.
Understood.
So by the end of 3 years, when you look back, you're like, okay, this first year making this goof up. This is what is supposed to happen, or else this will lead to this. So that is when you retrospectively think. You realize, okay, I was such an idiot, I did not know what I was doing. But at the end, when you see, you realize every small mistake that's going to happen and which is going to affect the patient. So that quickly clicks into your head.
And that everything was taught in those 3 years.
Yeah, so you don't realize what's going on. You are like first year, yaar, ye senior ye kara raha hai, wo kara raha hai. Second year, you are like, कि अभी operate करना है मुझे. And you are holding retractors and stuff. That is the time when you are actually learning. So retracting itself is also an art. Because if you don't know to assist properly, that means you do not know the steps of the surgery. If you do not know the steps of the surgery, you cannot operate. So it all goes in a smooth flow.
So it's like a ladder. First, you have to learn how to, help the main doctor. Then you become the main doctor after some time. But what parts of oral surgery has helped you in other aspects of clinical dentistry?
So mainly what would happen is we would think, okay, now there's a tooth, you have to restore it. There's a tooth which is stuck in the bone, someone has impacted tooth, you can't get it out. Okay, call an oral surgeon and do it.
Yeah.
But then what happens is you restrict yourself only to thinking that much. So when you get into oral surgery, you tend to look a little broader.
Okay. Like how?
You will be like, okay, there's a tooth that is stuck over there. I did not notice the gums around. So many of the time what happens is people are like, okay, यहाँ पे अल्सर है, ये अल्सर दांत के वजह से हो गया रहेगा, हम दांत निकाल देते हैं. पर वो अल्सर किस टाइप का है ये पता नहीं
अपने को बराबर.
So once I get into oral surgery and okay, this ulcer is there, it is suspicious. So maybe it is cancer, maybe it is not. I need to check out the ulcer first. I need to examine the ulcer. I need to make sure it is not cancerous. And it is only, or maybe the patient's stomach upset which is causing a cancer. So you broaden your horizons completely. So you don't just look only at the teeth. You're looking at the patient's profile completely as a whole, and you're looking at the whole functioning of the body.
Understood. Yes. So, like you said just a few minutes back, you have everything ready. What can go wrong in the future? You are ready for that. But has there been any incidents where you have planned everything and still something has gone wrong?
Yeah, so recently we done it happens most of the time in many of the surgeries also.
Okay.
So recently we planned one surgery, we got all the surgical guides, we'll do this, we'll do that. But then there was one minor point which was a technical difference, was a surgical skill difference.
Okay.
So we do it in a particular way, someone else does it in a particular way. So the moment you realize, okay, there might be something wrong over here, then you're like, okay, now this has happened. We've planned for it. Now we need to implement it.
So do you still continue with the plan? Like you go ahead with the plan, or you you have to be so quick that you have to make those adjustments on that moment itself?
No, so what happens is, even if we have a plan A, so for suppose there are 10 steps in plan A, so we always go with a backup of all 10 steps. So anytime there is a problem at one point, you already have a backup and you know how to fix that up at that very point.
But what if even the backup fails? Like, do you have a backup of the backup?
That is now upon the seniors.
No, like you think about it, right? Like, because there are times where things happen which are not under our control.
Right. So in case if we come across such situations where, okay, we made a plan, we have a plan A, that fails, we have a plan B, that fails, then we always have a plan C.
Okay.
So the plan C is, I'm out of plans, I need to call up my seniors, I need to discuss it with them.
Okay, fair
and
enough.
I need to go ahead. So major surgeries, whenever we do, it's not like, people might be capable of doing it alone, but like we've always worked in a team.
As a team, yeah.
Yeah, so we always, as juniors, we learn stuff. We tend to discuss it with our seniors. Then we go discuss it with our staff who've got maybe a lot of experience. Like maybe there's someone who's got 30 years of experience. I've seen probably maybe one case, like one particular fracture happening maybe 50 times, 100 times. They've seen it over 30 years, like maybe 100 or maybe thousands of times.
Experience matters at the
Yeah,
end.
so my 30 versus 1,000, there's a difference of 970. So the experience of 970, I get it ready-made just by speaking or discussing it with them. So there you realize, okay, I hadn't thought about this point. This is the point I need to remember while I'm operating.
Understood. So, what do you think is the main difference between studying dentistry when you're doing oral surgery and like you're doing a master's and studying dentistry as an undergraduate?
So as an undergraduate, what happens is you're taught everything. You're taught to, look after the patient's oral cavity. You need to keep a close watch on the teeth. You need to make sure the patient's hygiene is important. You need to make sure the patient is completely fine and everything. But once you come into oral surgery, you move slightly away from dentistry. Not in the sense you are a dentist, but the work that you're doing is going to be associated with dentistry, but just not dentistry. You expand more. So from the teeth, from the periodontium, from the gums, you are going to a much bigger scale. You're going towards the bones.
Skull.
Yeah, you're going and operating all over the face now. So if there's a fracture, okay, a dentist will replace the teeth. But what about the fracture?
True.
So we tend to fix the fracture. And the main difference that happens over here is we do not forget our basics of dentistry. So we keep occlusion in mind. We make sure that bite is completely in position, and then the fractures are fixed together. So there are many such cases where you feel like, okay, I'm an oral and maxillofacial surgeon. Yeah, but root is you're a dentist. Eventually, no matter whatever said and done, you tend to eventually check the teeth if they are still biting or not, and if the patient has a good smile or not.
That's a good point. So speaking about your undergraduate, you did your undergraduation again in DY. How was that experience?
DY was pretty good. I had amazing seniors, like someone who's sitting right in front of me.
I was with you for almost 5-6 years.
Yeah.
So I've seen you also grow from. But then I want to know your perspective. How was your experience, like personally, from your first year to your internship? How was your BDS experience?
Like in the first year we come, we are like, yeah, you don't care about anything, whatever is happening. You are like, हाँ देख लेंगे, time है. Second year you come, you are like, हाँ अभी भी time है. Third year you come, you are like, हाँ अभी भी हम लोग बिंदास है. अभी हम बीच में अभी करना क्या है? Final you are like, नहीं यार, high profile बहुत महंगा पड़ रहा है, बहुत झाप पड़ रही है. You have to go completely low profile, just focus on your work, get out. But then it eventually doesn't work out. Because the moment, there are breaks in college, you see a TT table which was there during our time.
Yeah.
We all tend to go near the TT table. We are playing with our staff, we are playing amongst each other, and we are like, losers to move. You lost, you move. No second chance. Just move from here. Then again you come to internship and then you're like, you have this again carefree attitude, okay, चलो कुछ नहीं है, internship है, पढ़ना नहीं है.
इतना साल struggle किया, अभी internship में तो मजा करना है.
You come like, yeah, you come like that in the beginning. Like अभी 4 साल हो गया भाई, internship में मजा करने का, घूमने का, ये करने का. And then by the time you come towards the end, you're like again, okay, मैंने internship का भी साल गवा दिया है. अभी मुझे करना क्या है? Then how much ever you've enjoyed, you've bunked everything, you go to the staff and you're like, sir, sign. They're like, बेटा अटेंड तो नहीं किया तुमने. साइन कैसे दे हम लोग. So that is when you realize, you hit back to reality. Okay, you've gone into internship, you've had your fun, now come back.
Extensions.
Yeah, you come back to extensions, we'll fix you up, don't worry.
Yeah. But like, did you enjoy your BDS days or?
Yeah, I absolutely enjoyed my BDS days. Like bunking class, playing table tennis, going out with friends.
And honestly, those are the memories which actually stay with you.
Yeah.
I mean, I don't think we remember our second or third year marks, but we remember what we did in second or third year with our friends and teachers. So, but why dentistry? Why did you choose dentistry as your career?
So, what happened is, like, I was speaking to when you're just entering your 12th and stuff, you tend to talk to people. You're like, okay, मुझे doctor बनना है. But किस type का doctor बनना है तुम्हें पता नहीं है. So I happened to speak to one of my aunt who's a periodontist.
Okay.
And she told me, see, you can become a doctor. You can still treat patients. So I was like, yeah. And I was wondering, okay, what is she getting up to right now? So that is when she told me, ki, as a person, you are going to just, like, there's one person. At the same time, that one person has probably 32 teeth.
Yeah.
So do you want, and all those 32 teeth are going to get you money. So do you want to just treat one person who will have multiple problems? Or treat one person who has 32 teeth and he can have a number of problems without any emergency.
So you got influenced with that?
Yeah, so that is the time, when you're thinking actually, you're told that you need to find a career that is going to be paying, you need to find this, you need to find that. Then you're like, okay, अच्छा है. Then I was again like, कि नहीं मुझे surgeon बनना है तो मैं dentistry में जाके surgery कैसे करूँ? So then she asked me the full form. I was like, okay, आ गया dental surgery इसमें. Then I was like, कि नहीं पर ये और क्या कर सकता हूँ मैं इसमें? And she told me, तो पहले जा तो सही. So I was still very adamant.
जा मतलब join कर दे.
हाँ, I was very adamant. नहीं, मैं नहीं जाऊँगा. मुझे नहीं करना है. मुझे बताओ पहले. So then she explained me, okay, these are the different branches that you can go into. These are the different surgeries that you can do once you get into. And then I was like, okay, there are many people who are going into MBBS. There are many people who are doing PG, general surgery, this, that, and everything. And I was like, okay, this particular field, if I get into oral surgery later on, if I develop an interest, then it is an amalgamation of so many things.
Yeah.
Like you don't, as a UG, you're like, okay, आप लोग ये भी कर दो. हम लोग का ये अंकल है, वो कैंसर सर्जन है, वो ये करता है. like, हाँ, हम लोग भी करते हैं. हाँ. So as a UG, I had no clue what to do later on, what is the scope of it. So the moment I realized, I'm like, okay, this particular field is an amalgamation of a lot of fields. So at one time, I'm not just specializing in one thing. There are 3-4 different specialties that I'm learning about. Yeah, so that's how I got more influence towards dentistry and then oral surgery.
But are you happy with that decision that you chose to be a dentist?
Yeah, I'm very happy.
I mean, ऐसा कभी वक्त आया कि like, काश कुछ और कर देता या like ऐसा कभी
कभी होता है like when you tend to go to apply to hospitals and some hospitals are like कि आप क्या करते हो? Then you tell them, okay, I'm an oral and maxillofacial surgeon. And they look at you, अरे very nice. अच्छा तो आप करते क्या हो? And you're like,
oh
okay,
shit.
इनको पता ही नहीं अभी क्या करते हैं. So then you have to sit and explain them. And then later on they'll be like, हाँ मतलब अब करते क्या है? आपने क्या पढ़ाई की है? So then you're like,
it's
okay.
pissing off, right? Like,
yeah, so I'm like, okay, मैंने BDS किया है, मैंने MDS भी किया है. अच्छा तो आप डेंटिस्ट है ना, आप डेंटल सेटअप में जाके बैठो. So what I tend to tell them is initially when I started approaching, by dental setup मैं बैठूंगा. I'll work only for my specific branch. So that is up to an individual choice. Like I've done my master's, so I need to work on my master's degree. I don't mind doing basic dentistry, but I'll give preference to my master's work. But at the same time, I need to be able to go to the operation theatre and operate. So that guy is like, नहीं आपका उधर क्या काम है? So I had to sit down, I had to explain it to him for 15 minutes. And then he's like, sir, पर ये सारे डॉक्टर्स हैं. तो I was like, ये सारे डॉक्टर्स आपके सामने भी खड़े हैं, जो आपको 4 रखे इधर एक बंदा है जो सब कर सकता है.
बराबर.
So they were like कि नहीं सर हम लोग का हॉस्पिटल पॉलिसी नहीं है. So we were like, okay, तो मेरा भी पॉलिसी नहीं है. तो if you, because we have to stand and own up to our degrees कि boss, you do not value my degree, I cannot work for you.
तो ऐसा काफ़ी बार हुआ रहेगा.
हाँ.
It's pissing off,
yeah.
But it's okay. I mean, eventually you will land up where you are supposed to land up and where you're treated with respect.
Yeah, absolutely. Like those people are not aware. That is sad on their part.
True.
Not at all on our part.
True. So what was like your highest point during your BDS days? Like you thought you peaked? Like
the highest point would probably be during my internship.
Okay.
So that time I was contesting for the general secretary post. I became the co-general secretary of the college, and at the same time I was working in all the extracurricular events and all that would happen inside college. I was involved in the Indian Super League also, that was there. Then I was involved.
It was happening in DY.
It was happening in DY. So me and my friends, we all met. We are like, ये event हो रहा है भाई, काम करने का है.
So you got to work a lot in sports during internship.
Yeah, so I always had a passion for sports. And I was like, if there's something that's keeping me communicated with sports, I don't want to leave it, because you tend to evolve, you learn a lot of things and all these things. So that time also, one day prior, we were like, हम लोग 10 लोग हैं, हम लोग जाने वाले हैं. Next day while going, we were like 5. Like, बाकी 5 लोग गए किधर? नहीं यार, इतनी मेहनत नहीं करनी. Then finally, like, चलो जाते हैं. So eventually it was only one I reached. So luckily I went and met Salvi sir, who was the secretary. He introduced me to Vrundan sir, who was handling all these major projects.
Yeah.
So then I went, I met sir, spoke to him. He's like, okay, I'll let you know. So then once in the evening I got a call, do you want to do this job? I had absolutely no clue what he's asking. I was like, sir, karna hai. So I got into that, then I started working over there. Then you see how the event and all happens. And that event was amazing. Like, it was the first time the Indian Super League they had actually organized it. It was happening in DY. You have an ID card, you're roaming around with an ID card. There's barely people who are stopping you. Okay, you can't go. Certain areas you can't go. But then again, people are like, okay, you can't go in this area. Then you meet your friends over there who have come on a ticket. And you're like, अरे अच्छा तुम लोग टिकट पे आए हो?
गरीब लोग साले.
अच्छा तुम फुकट में लिया रहेगा ना तुम लोगों ने वहाँ के. मेरे को जरूरत नहीं है, मैं सब मैच देखता हूँ. देखो ID card है मेरे पास. Then they tend to be like, अरे can you take us over there? Can you introduce us to this person and that person? वो celebrity है, उसके साथ photo चाहिए.
Did you meet any footballers like?
Yeah. I met Nicolas Anelka. I met Del Piero.
Ronaldinho.
I have met Roberto Carlos, the highlight of Indian Super League.
Wow. I mean, and that's purely because you were doing dentistry in DY at that time.
Yeah. So during the time I met Roberto Carlos, we were like strictly instructed, no photographs and all. And I was like, ये बंदे के साथ फोटो चाहिए. भले मेरे को निकाल दो, पर इस बंदे के सामने है 100 meter distance पे, I can not miss this chance.
So did you end up taking the photo?
Yeah, I have taken a photo and he's very kind.
But you have not posted it.
No, I haven't posted any single photo I've taken with any footballer.
Now you can, right? Now
those photos are the art.
So you can share it with us so that we can also see.
Yeah.
You know, कि हाँ हमारा दोस्त like हम नहीं मिल पाया, हमारा दोस्त मिल पाया वैसा.
हाँ, फिर दोस्त को हम लोगों ने क्रॉप करके निकाल दिया. अरे हम भी थे, वो दोस्त नहीं था, वो मैं ही था उधर.
So any memories you would want to share from your DY days?
DY days, I have a lot of memories. So if you're asking UG, PG,
I'm gonna ask you strictly PG right now.
UG?
Yeah, UG में. ऐसा कोई special memory which like you know instantly you think about and it comes to your mind.
UG, if you ask me special, I would be like our table tennis table over there. Like it's like 11 o'clock. We are juniors. We've come there at 10. We are playing. Seniors come. We are like 9. चलो रैकेट दो. लाइक नहीं रैकेट नहीं देंगे, लूजर्स टू मूव खेलेंगे. सो देन यू स्टार्ट प्लेइंग एट 11. देन यू रियलाइज ओके मैच चालू है, 15 पॉइंट्स 11 पॉइंट्स, इतनी सारी भीड़ कहाँ से आ गई. देन यू आर लाइक आर्ग्यूइंग एंड देन सडनली द स्टाफ कम्स इन. स्टाफ इज लाइक नहीं हम लोग स्टाफ है, हमको खेलना है. लाइक नहीं सर, लूजर्स टू मूव. अब हार के आपको जाना ही पड़ेगा. And then you bunk lecture. So once what happened, we bunked a lecture, we were playing down and the staff came down from that exact department. And we were shameless. We were playing exactly in front of the lift. The staff has come down, they're looking at us and we looked at them, smiled. Hi sir, kaise ho? And we're still playing and they're like, okay, isko sharam hai hi nahi. They're like, हाँ ठीक है, हमको आदत है, वैसे भी मस्ती करने वाले लोग हैं. So then we started speaking and sir like, तुम लोग lecture भी bunk करते हो ऐसा वैसा and all. They started playfully pulling our leg. And then we are like, सर तो फिर एक काम करते हैं, क्या करना है सर, मैच खेलते हैं. अगर हम लोग जीते तो आप हमारे ऊपर बैंड नहीं बजाओगे. अगर आप लोग जीते तो सर आप बैंड बजा तो सकते ही हो, पर थोड़ा बेनिफिट ऑफ डाउट दे दो हमको. सो व्हाट वी स्मार्टली डिड इज वी पुट अ गेम ऑफ ओनली 1. सो वी बीट देम. सो दे लाइक नहीं हमको और खेलना है, बेस्ट ऑफ 3. सो लाइक ओके बेस्ट ऑफ 3. देन मी एंड माय पार्टनर ये हारते हैं मैच जानबूझ के, थर्ड मैच खेलते हैं, थर्ड मैच में बराबर हम लोग लेते हैं. So then we purposely lost the second match, going very close. You hit the ball outside. Like okay, चलो बच गया. And they are thinking कि चलो हम लोग closing करेंगे. Like चलो और खेलने मिल रहा है.
और बराबर.
So then again you go to the final match in best of 3. And we again beat the staff and like yes बच गया. अभी सारा ऊपर बैंड नहीं बजाओगे. कौन बोला बेस्ट ऑफ 3? बेस्ट ऑफ 5 करते हैं, हम हरा के छोड़ेंगे तुम लोगों को. So then we again lost the 4th match. Then it went to the 5th match. 5th match we won. And then sir was like, हम तुम्हारी फिर भी बैंड बजाएंगे ऊपर.
Best of 7.
नहीं they are like, नहीं हमको जाने का अभी, खाना खाने का टाइम हो गया, तुम लोग तो खाते हो नहीं, तुम लोग नीचे खेलते रहते हो. Like okay, ठीक है. Everyone eventually knows about it that we play a lot.
But did you tell them later that तुम वो जानबूझ के हारे matches?
No.
2nd and 4th.
Now they know about it.
So, like, you know, thinking about your UG days, any mistake which you think, which you did, which you could have, like, you know, avoided?
The mistakes that I did was, I was not, you tend to think, okay, now you're sitting, you're there, you're carving, and you're like, क्या फायदा है carving का? किधर जिंदगी में हम लोग wax carve करने वाले हैं? Then you come to 2nd year. Then you are working on typhoid and so like अरे typhoid पे नहीं करूँगा मैं इतना अच्छे से, patient के मुंह में अच्छे से कर लूँगा. Then you work on a patient, you are like, okay, ये अभी समझा मुझे carving क्यों important है, मैंने तभी की नहीं थी और अभी मुझे नहीं जम रहा है उतना अच्छा. So those are like minor things which you realize later on, and like the basics, whatever you leave right now, all of that just comes back to you in your masters. And you're like, okay,
that's a very good
I
point.
should not have left it.
Yeah.
Thinking कि okay, कभी जिंदगी में काम आने वाला है, and वही चीज़ बराबर तुमको तभी सामने आ जाती है. And you're like, काश मैंने तभी किया होता, अब भी मुझे ये नहीं करना पड़ता. So you're like just walking maybe like 5-6 steps behind the normal people who've actually done everything and come and you're like, इसको पता है, इसने कभी पढ़ा रहे हैं. And then you wonder कि तूने कभी पढ़ा? Like अरे UG में था, like oh shit,
yeah.
ये चीज़ तो मैंने छोड़ी थी तभी.
Like good points. So like thinking, like speaking on that part only, what are the things that you learned in UG which has stayed with you till now?
So in UG mainly, you learn to, if you go at the professional aspect, you learn a lot of things. You're like, if you're only associated with dentistry, you will learn, okay, मुझे ऐसा करना है, मुझे वैसा करना है, ये step, वो step. And then doing all these extracurricular activities and everything, I learned that okay, there's a particular way in which you need to do all these big events. It's not like one fine day I get up, I'm like, I want to organize this event. I'm the head of this thing. Aisa nahi, it's a lot of planning.
Yeah.
And there are a lot of things that you seek. You're like, okay, now you need to do an event. You need you need fire department's permission, you need government's permission, you need this permission, you need that permission. Then you tend to go around, speak with people. You're like, okay, ye karna hai, wo karna hai. So when you're doing all these things, you realize there are a lot of places where you can actually just go and tell, okay, हम dentist हैं, हम ये करते हैं, वो करते हैं. Like during my internship, we had organized Swachh Bharat Abhiyan just around the DY campus. So what we had done is, we started from our college, we went out, cleaning everything. So there were like we got printed around like 200 jerseys. So there were around 200 participants who were actively going from one area, cleaning everything around the campus. And we came back inside the campus. And we finished it. So for that we went and spoke to the municipal commissioner कि सर हमको ऐसा करना है. And he was like कि हाँ करो अभी प्रधानमंत्री जी ने दिया है तो कर ही सकते हो, हम कौन होते हैं रुकाने वाले.
बराबर.
So like नहीं sir, we just wanted to inform. So he was like, yeah, you guys do it. But if there's any obstruction or something like that, someone's causing a problem, just give me a call. And that commissioner just handed me his card. He's like ये रख लो, अगर कोई इधर कुछ प्रॉब्लम कर रहा है, तकलीफ दे रहा है, मुझे कॉल कर दो, मैं देख लूँगा.
Okay.
So you tend to expand and
कुछ आए obstacles आए थे?
Obstacles तो कुछ नहीं है. Yeah, but
कचरा था.
Yeah, so while working, it's like कि पहला झाड़ू कौन मारेगा अभी? You're thinking कि अरे यार मेरे को पहला नहीं करना है, मैं नहीं करने वाला. But then when you see that one person's going, when you see 10 people getting into it, then you see 30, 40, hundreds of people going into it, and you're like, okay, what is this? And then you think, okay, people are only cleaning. They are not just cleaning. They are enjoying. They are having fun. Like, two guys are cleaning over here. They see their friend over there who's standing over there not doing anything. They start to poke him with the sticks, run away and all that. So all these fun things happen. Then you start playing around here, there. But at the same time, the work is also progressing.
Understood.
The cleaning is happening, but everyone is having their fun. And we would make sure that everyone has their fun in all such things. Because having fun is very important in all this.
And I think those things we could do because we were in DY. Because DY gave, like especially doing UG in DY gave us a lot of opportunities.
Yeah. Plus the management, Vijay sir, Shivani ma'am, they are also extremely kind. You go to them, you tell them, okay, sir, हमको ये करना है. कैसे करने वाले हो? he'll get the plan from you. He's not going to say or no. He'll get the plan from you. Okay, you guys want to do it? Yes, sir. Karo. Any problem? Let me know. I'm there. So you always have that kind of, backing. Okay, हमको permission मिली, हमको करना है. And then you go to the college, you inform the dean, sir permission मिल गई करने को.
विजय सर ने बोला क्या ही नहीं बोलेंगे.
हाँ, they'll be like, हम लोग ने भी तो दिया था ना. हाँ, पर सर ऊपर से भी लेना पड़ता है ना. हाँ, तो वो तो आइडिया मैंने तुमको दिया था. And we're like, हाँ सर. Then they'll be like, विजय सर आ रहे हैं. हाँ सर वो आ रहे हैं. चलो, very good. How did you manage to ask sir? Like, sir, we directly asked him, sir, can you come for the event for some time? He would be very kind. He'll come for the event. He'll wait there for a bit. He'll talk to people. Like, out of the huge schedule that he has and all, he would make sure that he comes, he gives you some time. And then he goes back. Not like he's not going to come. He's going to turn up. He's going to be there. He's going to speak to you for a bit. And he's going to go back.
Got it.
So you have that, motivation. Okay, हम इतने छोटे हैं.
Especially जब अपने को support, backup मिलता है ना, तो like you have that, like you feel powerful. Like backup है, तो like we can do anything with it.
Right. There are some people who will just give you backup. हाँ तू कर मैं है. But तुम जब कर रहे हो और वो बंदा आके देखता है, that is the moment you feel like okay, this person is not someone who's just gonna like sit there, talk to you, be like okay करो मैं हूँ कुछ लगेगा तो. No, but that person is actually on field. And when you look at your boss, suppose you look at your boss who's telling okay do. The boss comes on field and you see him on field and you're like, okay, this is the kind of person I want to be. I don't want to be someone who's, just sitting in the office talking. Someone who comes to the field and you look at like, okay, sir, idhar bhi aaye hai. And then you're like, you go meet sir, you're very happy because you don't expect them to come. And they're like, no, these are my people, I need to come. That is a sense you get, That is a sense that especially we get in DY.
And that's great. Like
that's amazing.
And like even after graduating from DY, I've gone to many colleges. You don't get that. Like, from DY has that special thing going on. You also did a FIFA youth program.
Yeah.
Like an officer program. So what was that like whole thing about and how did you get in?
So actually what happened is the FIFA programs and all, they started when I was doing my internship. So they would have these regular pitch workshops in which they would teach us how to take care of the pitch and all. So there's a groundsman known as Dean Glasby who had come. So he would explain, like, I'm a groundsman, and we are like, okay, he has absolutely no problem on being a groundsman. And then we realized, okay. And then all of us who would play football, we are like, kuch bhi ho jaye, FIFA to karna hi hai. So we were like around 40-50 of us, but then few of them passed out, they went here, they went there, and I luckily came back from my PG. And in 2017, when I came to know, okay, FIFA is happening, I was like, FIFA to karna hai. भले सिक्योरिटी गार्ड बन के गेट पे खड़े रहेंगे पर फीफा करेंगे. दिस इज लाइक वंस इन अ लाइफ टाइम अपॉर्चुनिटी.
या सो दिस वाज लाइक अ कोर्स और
no, so this was a proper FIFA under 17 boys World Cup that was happening at DY.
Understood. But ये जो था youth program officer, like how do you become one? Or
so what had happened was there are certain designations that FIFA appoints. So there is basically FIFA is one body. There is one body known as the local organizing committee. So the local organizing committee has one central team and one local team. So the central team functions as the central government. Local team functions as the state government.
Okay.
So you had maybe like 4 venues, 5 venues. And among the 4 venues or 5 venues, there were around, you can catch around like 50 people.
Got it.
Who were from the state government. So in a population of around 1.4 billion, you are among those 500 people who are getting to work in FIFA, getting a FIFA jersey, you're getting a FIFA bag, you're walking in those old FIFA outfits. Like it's a different ball game altogether. You can't imagine. Like now also when we just talk to our guys, you're like, yeah, FIFA was the time. So what happened is I would work in all the extracurricular activities in college, organizing the university sports fair. So I was heading it for like 4 years and stuff. So there we tend to come in contact with these people. I would help them in all whatever other events and all what would happen. So when this post came up, they asked me, do you want to take it up? I'm like, sir, yes. FIFA, I'm not saying I don't do anything. So that is how I got into this program.
So what was taught in that program?
So it was not exactly taught or something. So what would happen is
more
mainly
like a responsibility?
Yeah, so the responsibility was all the ball boys who come, the opening ceremony, you see people coming in over there. You're like, okay, you have to get all these kids in line, and they are very specific. Like, ये time पे, ये second पे, ये चीज़ होनी चाहिए.
Yeah.
So you call the kids, you train them, they're trained on field. Plus the kids get a whole FIFA kit, like a bag, they get a jersey, they get their shoes, they get their stockings, they get their socks. They can all just boast around everywhere कि हमको ये मिला है, हमको ये सब मिला है करके, and all. They're like, okay, good. So I would mainly handle all the ball boys over there, the opening ceremony, the closing ceremony, what would happen. So that was majorly what I would look after over there as a youth program officer.
So, like having worked so closely with FIFA and football in India, what's like your take on India's current position in the whole global scenario?
Like now, if you tend to see compared to what it was before, we are moving forward.
In what way?
In the way of the term that we are getting support. You're getting better grounds right now that were not there. I remember you just play कि चलो building में खेल लिया हम लोग ने.
Do you remember first time में जो football ground था?
Yeah.
जहाँ hotel management के just पहले अभी जहाँ construction हो गया.
So now that's a huge building that has come up.
But that was supposed to be the football ground and it was so bad. Like now, and now when you see those grounds, like जो DY Patil football के लिए दिया, especially dedicated to football, like so nice.
Okay, so now there's a huge ground you can play on. That our old football ground is now a huge school, management school that they built up, and they're planning to introduce a lot of more programs over there. So in terms of that, you see the government also pushing in for it. They're like, okay, no, we don't want our kids to be something else. Let them play. So then you are like, कहाँ खेलेंगे हम लोग? So they're making grounds for you. They're getting provisions for you. They're giving you support. Though it's going to take time to come from grassroots, and the problem is we compare it directly with European standards that has been set since so many years.
Because we are seeing European football, right? So then वो हो जाता है. Like it's an inevitable thing.
Yeah.
Like so, do you play yourself?
Yeah, I play.
You still play?
Yeah.
Like ऐसा कोई time था where you wanted to become a professional footballer and play for India?
No, I didn't ever want to become a professional footballer. Like, I just love to play and I would enjoy playing it. Nothing like I wanted to go professional or something.
No, but like now when you see so many things, is like choosing football a viable career option for guys out there now?
It's like you can choose, but at the same time, you always need to remember that when you're training to go professional, you need to train in the right way. You cannot make mistakes while you're training. If you make mistakes while you're training, you land up with an injury, and that injury can just pull you out of the sport, and you're like, okay, I've done this, I have no backup, now what do I do in my life? So in a training, it's going to be a slow process. Like some people might just quickly snap, they'll go way ahead of you.
Understood.
That does not mean you can't catch up to them. You'll catch up to them slowly. But you need to train in the right way, making sure you do not get injured, your body balance and everything. There are a lot of things that come into picture. You need to train properly and get to it.
You're also the coordinator during the recent, a medical coordinator during the IPL and the FIFA Asian Women's Championship.
Yeah.
So how was that experience?
So that experience was also completely different. You're working over there, you're like, as a doctor, you're like, okay, ये लोग ने ये चीज़ बोली, and I'm like, मेरा medical science को support नहीं करता है. And then you're like
what things?
Like you have to constantly get an RT-PCR test done. You are told to go and do something known as bubble area where the players are.
Yeah.
You're not supposed to come in contact with the players, which is but natural in a tournament. Like people
it's
feel
physical
that
sport, contact sport है.
Yeah.
होने वाला है.
हाँ, अभी वो टीम्स ड्रेसिंग रूम में है, लोगों को लगता है ये ड्रेसिंग रूम में जा सकता है, अंदर आके फोटो निकालेगा, ऐसा कर सकता है. No, it does not happen that way.
But वही तो हुआ, right? The entire team got positive. Like few of the players got positive.
Yeah, so for people getting positive, they can get positive from anywhere.
But उसके वजह से I think the team had disqualified, right? Got disqualified, if I'm not wrong.
Yeah, disqualified, or maybe you can say we just had to back out because we could not participate. Like multiple issues over there. Like a bubble breach can happen from anywhere. Like you can't particularly blame this is the person who's not followed the protocol. This person has done this.
You can't pinpoint.
Yeah, you can't pinpoint. Okay, it's like okay, it's happened. We are sad, but unfortunately, it's happened with our team.
Got it. What about IPL? How was that experience?
IPL was also amazing. It's like you go over there, you're working, you're roaming here, there constantly. You have to keep an eye. Okay, VIP areas are there. There's no problem in the VIP. You need to go to the stand. You need to check in the stand. Okay, is everything all right? Like you have medical kiosks which are set over there. But at the same time, you need to make sure you go all around, keep taking rounds. So I remember there was one day where I've actually walked 30 kilometers.
Wow. In a day?
Yeah. And that too, my day started from 10 o'clock. And by the end, I was like, My legs are giving up. I don't know what's going on. So I just looked. I'm like, okay, 30,000 kilometers. Sorry, 30 kilometers. I'm like, okay. आज मैं भगवान को याद करके सोता हूँ मेरी पैर की बैंड बजने वाली है.
But so many now when you're saying so many, it's all, I think it's because you were fortunate enough to do be in DY at the right time when IPL is happening, the FIFA World Cup was happening, ISL happened.
Right.
So you have been lucky that way.
Absolutely.
You also have done a fellowship in oral oncology.
Yeah.
So why did you feel the need to do it? Especially you have done a master's, so then why a fellowship in that?
So one thing what I noticed outside was the moment you go, you introduce, okay, I'm an oral and maxillofacial surgeon. These all are the things I do. People are like we spoke about it, they just tend to piss you off over there and you're like, okay. So then there is one thing about oncology that I learned is you tend to, you have that thing in you, okay, complication हुआ मुझे manage करने आता है. You can manage all complications, but at the same time, it does not mean we go and cause complications.
Got it.
Like you become stronger, not in the sense that someone who's done their master is not strong. Okay, they are stronger. My personal perspective was, okay, I need to do something more. And then one more thing, very important thing that I realized was, okay, 100 people from my batch got into dentistry. Out of that, 30 did masters. 5 of them are oral surgeons. Now, how am I different from them? So I got into a fellowship, then I realized...
helps you distinguish yourself from other people.
So now it's a trend that, okay, doing masters is not it. You have to go keep climbing higher. You cannot be at that same position.
And what's your take? Every dentist, every BDS has to do a master's, or they're okay doing BDS and then doing something else?
See, now again, if you ask me, I would be like, okay, what do you want to do masters? And someone tells me, okay, orthodontics. I'm like, masters करना ही है. तुम बोलते हो ओरल सर्जन बनना है, करना ही है. बाकी हमको एंडो करना है, रूट कनाल सीखना है. I to learn as a dentist also, but if you want to do it in an expert way, then you need to do your masters. Not like as a basic dentist you can't do stuff. You can do all the stuff. If you see all the senior practitioners who are practicing, they do everything on their own. They barely call anyone.
And they're not MDs also.
Yeah, and they're like, हमको आता है, हम नहीं करते, हम बुलाते नहीं, हम खुद ही करते हैं. Like, कि नहीं ये मास्टर्स का है, हमको करना चाहिए. Like, you think in your head, obviously you do not speak it out. And you look at them work sometime and you're like, okay, this guy is absolutely fantastic. And so they have been trained that way. So it's not like if you do your basic dentistry, you have to do a master's.
Yeah, that's what my question was. Is it a must thing to do? Like you have to do masters.
Like certain fields you have to do masters. Certain fields, it's okay if you don't do. And then eventually it lands up to you. Like, नहीं यार मैंने 5 साल बहुत पढ़ लिया. भले पढ़ाई आधे लोग ने की नहीं होती है, but 5 साल पढ़ लिया, अभी आगे मुझसे और ना हो पाएगा.
So it all comes down to personal preference.
Yeah. So if like someone's done a BDS, they're like, okay, मुझे नहीं करना है, fair enough, it's up to them. Someone's done BDS, they're like, नहीं मुझे MDS करना है, MDS हुआ नहीं मुझे अब तक, I'm still not satisfied. मुझे अभी ये करना है, ये भी कर लिया. Then you go outside, you see, अरे मेरे को लगा मैं अकेला रहूँगा बाहर, देखो और 100 लोग हैं, अभी मुझे 100 में भी स्टैंड आउट करना है वो.
बराबर.
Then like मुझे और कुछ करना है.
It's a never-ending cycle, yeah.
Yeah, it's a never-ending cycle.
But you have to keep upgrading yourself.
Yeah.
Because dentistry is as a profession is like that, because new things are coming in.
Right.
One thing I forgot to ask you about the oral oncology part was, so what was taught in the program?
So mainly it's completely dealing with oral cancer, whatever we see. So there you tend to see a lot of different cases. You learn how to manage these cases. You learn how to talk to people. Now if you tell a person के हाँ आपका दांत टूट गया, people might take it lightly. हाँ ठीक है चलो दांत का क्या है वो निकल जाएगा हो जाएगा. General attitude what people have. But the moment you convey to a patient कि नहीं आपको कैंसर है, and cancer is something that people will be like, अब मैं मरने वाला हूँ. You have to convince them, okay, कि आपको है. This is not the end of the world for you. You can still fight it. You can come out.
Because that's what they show in movies, right? वो ad नहीं tobacco का मुकेश. That's what they show. कि you have oral. I mean, very sad thing to show someone, but like that, कि you have cancer, you're gonna die. So वो assumption हो जाता है वैसा. So next question was, who should do it? I mean, of course, you can do it after oral surgery, but who should do this fellowship according to you?
So according to me, anyone who has a liking, who wants to study something further, you can always go into it. You can always learn about it. It's not going to stop. And one memory that I have about during my fellowship tenure was one patient I remember to come. Was very reluctant. He could not open his mouth. His cancer had spread a lot. He's not ready to get operated. Everyone's convincing him. And then I was like, यार खाने का टाइम हो गया, ये पेशेंट क्यों इतना भाव कर रहा है, रुक मैं बात करके आता हूँ. मैं कलीग्स आ रहे कि तू कुछ सुना के मत आ जाना. लाइक अरे नहीं सुना, नहीं तेरे भूख का टाइम हो गया, तुमको पता है यू टेंड टू लूज योर हेड. लाइक अरे नहीं बाबा मैं बात करके, तो 5 मिनट दो.
बराबर.
सो आई वेंट, आई स्पोक टू दैट पेशेंट, आई केम बैक एंड आई एम लाइक अग्री कर रहा है, ऑपरेट कर दे. सो दे वर लाइक तूने बात क्या किया. सो आई वेंट टू एंड आई टोल्ड हिम जस्ट वन थिंग, आपको कैंसर है, ठीक है, अग्रीड. एंड इट इज़ नॉट एट वन स्टेज वेयर योर लाइफ कैन नॉट बी सेव्ड. आपको सब लोग बोलेंगे कैंसर है, इतना फैला है, स्टेज 4 है, ऐसा है वैसा है, आप मरने वाले हो. सो आई जस्ट टोल्ड हिम वन थिंग कि आपकी फैमिली इतनी आपके साथ है अभी. आप ऑपरेट करोगे, आपकी फैमिली तभी भी आपके साथ है. आप हील करोगे, आपकी फैमिली अब तभी भी आपके साथ है. आप अभी बीमारी के साथ जियोगे, फैमिली को पूरा टाइम स्ट्रेस, आपको स्ट्रेस, आपकी ये हालत आपकी फैमिली से देखी नहीं जाएगी. और आपको उनको क्यों तकलीफ देने के. सब इतना अच्छा आपके बारे में बोलते हैं कि आपने ये किया है, घर संभाला है वगैरह. आपके सब लोग ने अभी आपके सामने सब बोला है.
बराबर.
तो आपको उनको क्यों तकलीफ देनी है. आप ये ऑपरेशन करो अगर आपको चाहिए तो. नहीं कि देखो अगर कैंसर वापस आने वाला है, वो वापस आने वाला है. बट एट द सेम टाइम अगर आप ऑपरेट करते हो और आप कैंसर फ्री हो जाते हो, आप इमेजिन करो आपकी फैमिली कितनी खुश रहेगी आपके साथ. अगर आपको बीमारी के साथ समझो 4 महीना मिल रहा है, अगर आप ऑपरेट करते हो, बीमारी निकल जाती है, क्या बात है. आप आगे जो भी ट्रीटमेंट है आप सब करते हो, आपको सब जगह आपकी फैमिली के साथ जाने को मिलता है. देन ही वाज लाइक कि ठीक है, दोज रिलेटिव्स वर कन्विंसिंग हिम फॉर अ लॉन्ग टाइम कि नो गेट ऑपरेटेड. सो आई डोंट नो व्हाट सडनली क्लिक्ड इनटू हिम. लाइक आप रहोगे ऑपरेशन थिएटर में. हाँ हम लोग सब रहेंगे. नहीं सब नहीं, आप रहोगे क्या. नहीं लाइक हाँ सर मैं हूँ, तो मैं ऑपरेशन के लिए रेडी हूँ. So the moment after that he got operated.
How is he now?
He's amazing. So at the time I was doing my fellowship, every time he's come for a follow-up, he's always got sweets and all for you. And he's been like, you're the reason why I got operated and why I'm alive. So all his family members are like, okay. So sometimes some family members come and these people tend to go out and they're like talking, okay, यहाँ पे ये doctor थे, इन्होंने convince किया and all that. So it feels nice in the end.
No, and feels nice and makes you feel worthy enough, like you feel proud, like कि इतना like जो अपने मेहनत किए, इतना पढ़ाई किए, and then like किसी की होती है ज़बान अच्छी नहीं होती, then they may be good clinicians but they are not nice talking. But then if your work is good, if your ज़बान is good, like your tongue is nice, and then you convince the patient gets convinced and you operate, and then you see results, like and the patient thanks you from the bottom of his heart, the entire family. It just, I mean, you feel overwhelmed with emotions.
Absolutely. So there have been certain patients who've come like this. There was one patient in my post-graduation that we had operated on in my first year. Like that family still messages me. Every doctor's day, without fail, there is a message from that family. कि thank you so much. And you're like, 6 साल हो गए इस बात को, ये अब तक भूले नहीं इस चीज़ को. So those are the moments that make it worth. Okay, all the struggle, all the sleepless nights that we have, the number of times we've had to listen to our senior professors who काम बराबर नहीं करो, and one message from one patient this way, it completely makes it all worth it.
Basically, oral surgery changes lives.
Yeah.
Like completely.
Yeah.
So coming to our final section is the rapid fire section. So it's a new thing which we've started. So are you ready for it?
Not at all. Especially with you on the opposite side, I'm not at all ready.
No, I've kept it very simple so that if you are happy with this episode, we're going to call you again where we're going to have even more brutal questions. But
okay,
we'll start.
So the brutal questions need to go both the sides. They cannot go one side.
I'm okay. I mean, so first we'll go through this thing. Your favorite dental instrument?
My favorite dental instrument right now, it is a luxator.
Okay, and why?
Just makes life easy to extract a tooth.
Good answer. Favorite football club?
Favorite football club? I was, and I still am a gunner for Arsenal.
Have you visited the Emirates Stadium in London?
No. The time I could actually get some time and go, and then COVID had some other plans.
So are you planning anytime soon?
Yeah. Once in a life, I have to go there and I have to see that.
Tough time. I mean, it's been a rough last few years, a last decade for you guys.
Yeah, but I can still remind you about the Invincibles. 49 unbeaten.
We were the ones who broke the record, unbeaten record, by the way.
Still, you couldn't manage to break our record.
That's a different podcast.
You might get many trophies, but you do not have a golden trophy.
We'll have a Arsenal versus Manchester United exclusive.
Friendly exclusive.
Episode once. Like favorite BDS posting.
Favorite BDS posting? I'd say ortho.
I was expecting oral surgery, but why ortho?
Ortho, you can just say it. Initially, you're like straightening wires, and I'm like, ठीक है यार, बोर हो रहा है. एंडिंग में पूछते हैं कि हुआ क्या नहीं सर वायर स्ट्रेटन नहीं हुआ. और चिलिंग हुआ था बीच में वॉशरूम के नाम पे हम लोग निकल गए नीचे खेल के आ गए. ठीक है चलो सर.
Chill the department.
Yeah.
And very chill professors also.
Yeah, the professors were strict. They're like, काम करो तो अटेंडेंस मिलेगा. So many of the times I managed to miss my attendance because of it. And then somehow you're like, okay, अभी attendance चाहिए तो इसका वायर लिया, attendance दिया. And then somehow they found out, okay, wires are repeating. So they started punching the wires and we were like, shit, अभी क्या करें? Then we are like, absent, भाग जाओ. So like we've had a fun over there in the department. Not like we've not enjoyed.
Just the other day I was thinking about कि Adam's class अपने बनाए हैं. Use किधर कर रहे हैं अपन? I understand it's necessary to know it. I was just thinking in it, like this. Favorite football player?
Favorite football player all time is going to be Ronaldinho.
Ronaldinho.
Yeah.
Any chances like you got to see him? I mean,
not at all. Like if I get to see him, like Ronaldinho is like at the top. But you see him play, it's all just magic.
He was magic.
Like you can't ever get a player like him. It's not possible only.
Great answer. One thing you dislike about being an oral surgeon?
One thing I dislike. I wouldn't say dislike, but at the same time, I'd say that we can operate way much more.
In what way? I mean,
like there are maybe like 30 procedures that we can do, 40 procedures we can do. We want to do all of it. And at the same time, hospitals are like, okay, sometimes you cannot do this, you cannot do that. So it sometimes varies from place to place. So that is the time you think, यार ये बंदा इधर ये चीज़ कर सकता है, मैं यहाँ पे ये चीज़ नहीं कर सकता हूँ. So that times you feel a little bit pissed off. You're like कि नहीं यार काश मैं उधर होता.
Got it. One thing you would like to change about dentistry in India?
The only thing that I would like to change is like people need more exclusive hands-on. Like you do your pre-clinics and everything.
You mean the students?
Yeah. Pre-clinics you do, absolutely agreed. But you need, they teach you everything. Agreed. Now, my personal perspective would be like, you need to learn how do you work in a clinic. So, clinic work is totally different. The work what you're doing in the department is totally different. Like you need to be, I feel, you need to have a posting in which you're handling the patient in all the aspects.
It has to be that you're out of college and you are ready to work in a clinic, which is not the case.
Exactly.
I mean, and of course, we have spoken to so many colleagues of ours, juniors. Everyone has the same thing to say. कि college में कुछ और सिखाते हैं and जैसे आप clinic में काम करते कुछ और ही रहता है. So that, I mean, like rightly said, you need to at least have a conditioning कि clinic में ऐसा होता है. So know that.
Right. And like the educational curriculum that is there, no doubt it's good. But what I feel is you need to get those youngsters up over there, youngsters who are into latest things. Because like you are taught very basic stuff. You go to the conferences, you're like, oh shit, ये बंदा इतना करता है, ऐसा करता है. Then you speak to people who are abroad, they're like, ये तुम अब तक यही कर रहे हो, हम लोग तो ये सब कर रहे हैं. And you're like, and when you do that in India, you're like, oh, he's such a big dentist, he does this, he does that. You talk to your colleagues abroad, they're like, this thing we've been doing since ages, यार इसमें क्या नया है? So like, we need to level up. We cannot be at the same level that we are right now.
Got it.
So that reminds me, at FIFA there was one instance where we were all just sitting, chilling in our LOC common room over there, like local organizing common room, and like having fun. So there's one guy who gets a call, he just runs, and they're like, "Ye bhaga." You see 2-3 guys running after them. We have absolutely no clue what is going on. So even we start running. So then later on we found out कि बहुत भाग रहे हैं यार. So then me and my friends got into the car. We were like, कार से जाके देखते इतना क्यों भाग रहे हैं हम लोग. So then we noticed a few barricades fallen somewhere. बैरिकेड गिर के तो ये लोग इतना क्यों भाग रहे हैं. Then later on we got to know, okay, so one of our colleagues, he got into an accident.
Oh.
So one of the barricades hit him on the head. He had a huge cut over here. So he was luckily taken to DY only. And I was like, किधर लगा उसको? ये like चेहरे पे मोड़ा. जल्दी casualty ले. मेरा call नहीं है पर this is my specialty. I'm going over there. So when he got there, I saw him, and he was told कि आपका शायद eyebrows निकालना पड़ेगा. So he got very nervous. Like imagine a guy roaming around with our eyebrows. Like obviously you notice it, not more than you notice the missing tooth. But he was like very taken aback. Like shit यार लग गया, मैं तो अपना काम कर रहा था, अभी मैं क्या करूँ, मेरा आईब्रो निकालने का बोल रहे हैं. I just spoke to him and I told him कि you relax. Not gonna remove your eyebrow. We'll just close it up that way. We'll give you minimal suturing, not anything much. So then we got an X-ray done to just make sure again there is nothing. We are sure that okay clinically कुछ नहीं है इसको, but like radiological evidence रखते कि कुछ पक्का नहीं है इसको. We got the X-ray done, like nothing. So then I took him inside the minor surgery room where I injected local anesthesia. So then I started suturing. So that same time the few people from the stadium, the event management and all those people came from FIFA. Not actual FIFA team, but the local organizing committee वाला. They're like, तू इधर क्या कर रहा है? हमने क्या मतलब? तू क्यों कर रहा है? लाइक मैं यही करता हूँ. तू डॉक्टर है? लाइक हाँ, पर तू तो डेंटिस्ट है ना. मैं तो डेंटिस्ट नहीं कर सकता क्या? सो लाइक पर तू ये सब कब से करता है? बोले मेरा मास्टर इसी चीज़ में है. सो दैट इज व्हेन दे हैड अ डिफरेंट पर्सपेक्टिव ऑल टुगेदर. सो टिल देन दे न्यू कि डेंटिस्ट है, मास्टर्स कर रहा है. देन व्हेन दे सॉ दिस दे लाइक ओके, ये बंदा ये सब भी करता है.
अलग लेवल ऑफ रिस्पेक्ट मिला रहेगा उसके बाद.
हाँ, सो आई लाइक नाउ आई नीड टू, now I can proudly show off. So then one of the people came at the door. He looked at me and he like, what are you doing? I'm like, sir, nothing. Usual day in day out work. So that was when I was suturing, because they did not expect someone from dental would be doing this. So I did that. Then they were like, okay, good, he's fine. I like, हाँ, like काम कर सकता है. हाँ, लेकिन कुछ प्रॉब्लम नहीं है, पेन किलर एंटीबायोटिक दे देंगे हम लोग, and he can work. So then they took him back. Next day was the match. So we all told him कि आप रेस्ट कर लो. I was the only like, तेरे को आ रहा है, तू कुछ नहीं होगा, क्या होगा, हम लोग है ना इधर ही. So he felt good. He's like, okay, कुछ हुआ तो ये लोग इधर ही है. He had seen the way we treat him. He had seen the way we took care of him.
बराबर.
So he was pretty happy. And then next day before every match, we would have a huge meeting. So in that meeting, the tournament director was present, and he was the one who was narrating the whole incident. And that was the time when I felt so proud. Like, dentist, people are not aware. You come up there, your story's been narrated, you get a standing ovation from everyone. That was amazing feeling. And I was like, these are some moments what you live for actually.
That's very positive to know also. Like, and it's inspiring. Last rapid fire question. One quality you're looking for in your wife?
One quality. She needs to be a very good cook.
Okay. Are you like a foodie?
Huge one. So the only thing, if she has to fire me, yell at me or anything, she just has to keep food in front of me. I'll keep eating, she can keep talking. So not that I won't pay attention to it, because later on I might just be asked कि like, तू sorry बोल रहा है, किस चीज़ के लिए sorry बोल रहा है? I'll be like, इस चीज़ के लिए sorry बोल रहा हूँ. And then eventually know that हम कुछ भी बोले, हमको गाली तो और पड़ने वाली है. पर ठीक है, पेट तो भर गया अभी.
So ladies out there, you know the quality which Dr. Sohin needs. That's about
what
it.
is the quality that you would look for?
Patience.
Why?
Because I think having patience solves a lot of problems. Like, अगर कोई झगड़ा होने वाला है, if you have patience to understand that.
मतलब याद रखो, ये बंदा झगड़ा कर सकता है, वो तुमको तुम्हारा पेशेंस टेस्ट करेगा इस बारे में.
वो लोग सब करते हैं ना. तो like if you have patience to कुछ चीज़ें होते हैं which are in our control, but then if you keep patience.
हाँ, ऐसे बहुत सारी चीज़ें हो सकती है कि आप करो, वाइफ बोलेगी ये तो मेरे कंट्रोल में है ही नहीं, तो प्रॉब्लम हो सकता है.
हाँ, so I think patience is required. Like in today's time now, people have lost patience. सबको सब instant चाहिए, quick चाहिए, which leads to more problems. So that's it. So that's it for this episode, Dr. Sohin. Thank you for
Chal, thank you so
coming.
much.
We're going to have another one hopefully soon on the Manchester versus Arsenal thing also.
Yeah, but we need to get a few people
We'll
along
get,
with us, and
definitely.
we'll make sure that there are barricades and everything kept so that.
We'll have a FIFA match also, like a PlayStation, like you play.
Yeah. I got my PS4 at home.
Done. So then, hopefully, in the coming few months.
Yeah, but we're not going to display the PS4 match.
Why?
I wouldn't want you to feel bad, yeah, in case you lose.
चलेगा, कोई बात नहीं.
नहीं यार, ऐसे हम आपकी बेइज्जती नहीं कर सकते.
हमारे पास. No, but we have like, ठीक है. We'll keep that for the next episode. So thank you, Dr. Sohin, for taking your time
most welcome.
and coming for this podcast. We'll see you soon, and it was great having you.
Same here. Guruji.
वो next में बोलूँगा क्यों? Thank you.
Guruji.
बस.
Guruji was very important at the end.
हाँ ठीक है.
वो सिर्फ तेरे को समझेगा, बाकी किसी को नहीं. अरे अभी, या अभी का स्टूडेंट से अभी बात हुआ.